Have you ever had the thought, my child has a constant runny nose, and I'm not sure if I should do something about it? Well, if that's crossed your mind, you're in the right place. This video is about answering your top questions about kids with runny noses. Hi everyone, I'm Dr. Eileen Shi, a board-certified pediatrician. I work holistically with parents who want a child-centered approach to solve their children's health issues. So, if that sounds like you, make sure to subscribe to the channel for more content just like this. Having a frequent runny nose is not uncommon, especially in the early school ages, like 3 to 5 years of age. As a mom, I clearly recall that time when my child turned 18 months old, and that's the time when she started climbing on everything and touching objects and putting it in her mouth. And that's when the runny nose started, and it just kept going. So in this video, I will answer the questions that I get asked most often by parents like you who are raising their little ones and just trying to figure out what to do when their child has a runny nose. Question number one, my child has a runny nose and has been sneezing a lot, but I'm not sure if it's allergies or he's getting sick. How can you tell? Sneezing is one of the first symptoms that arise when you have a common cold. And yes, sneezing does bring to mind allergies. We sneeze a lot if there's something in the air that is triggering allergies or sensitivities. And allergies can be seasonal, environmental, or food-induced, especially if it's springtime and the flowers are blooming or there's some sensitive smells around you like chili peppers or strong scents. You may expect to see your child sneeze because of all that is going around in the air. However, if your child is sneezing but he's been indoors all day with no new scents or obvious triggers like having a new kitten in the house, it would be probably a little bit more suspicious. And I would probably think that sneezing may be the start of a common cold. Also, allergies don't cause fevers, fatigues, muscle aches, which would be seen more often with a viral common cold. It is hard for most parents to tell from the start when their child is sneezing if that's just allergies or a cold. But unlike you, I'm always hoping that it's just allergies. But usually in 2 to 3 days time, you would be able to tell other telltale signs that your child is sick, like having thick nasal discharges, headaches, fatigue, body aches, coughing, sore throat, and a decreased appetite. So to sum this up, allergies more likely when the sneezing is only in the early mornings, but it improves as the day progresses. And itchy eyes, itchy nose, but otherwise your child is acting like himself or herself. It's a common cold if the sneezing is prominent for a day or two, then followed by other runny noses, congestion, sore throats, fatigues, aches, and coughing. Question two, my kid has had a runny nose for almost 3 weeks now. He got better for a few days, then the runny nose is back and at it again. Do I need to worry? Well, this happens often, especially for school-age kids or kids who are around other kids, maybe through play dates or activities. Your child gets sick from one virus and develops a cold. It gets better because the body, like a superhero, fights it off. Then he worsens again after a few days. So what is happening? This often happens when the body gets exposed to a second virus while it is still getting over the first viral infection. When we are sick, our immune system is on high alert and working overtime to fight off that infection. And while this is going on, we are slightly more susceptible to catching another virus. Yes, you can get more than one virus at a time. And this is why when your child seems to get worse after a brief period of an improvement. So what to do, and do you need to worry? Well, if there's no new fevers or symptoms like shortness of breath, ear pain, or refusal to eat, you may want to give it a few more days for the body to fight off this second wave or new viral infection. The key is rest here and for the body to really get back its strength, which is why doctors often recommend that your child stay home until he is well enough to return to normal activities. This full recovery can take up to 3 to 4 weeks, depending on your child's health and condition. So be patient. Continue to encourage good hand washing, hydration, and rest so that the body can build itself up and get back to good health. By the way, if you found this video helpful, please give it a like and subscribe to the channel so that you will be notified for future contents just like this. Question 3. What can I do to keep my baby healthy if the older sibling is sick? Now, it's hard and may even feel cruel to keep one child away from the other, especially when they want to play together. For little babies, and I'm talking especially in the newbies under 6 to 8 weeks of life, getting sick and having a fever may lead to a complete workup with your pediatrician because newborns are so little and so vulnerable to more serious infections. For older kids and siblings, when one gets sick and is displaying sick symptoms, the chances are, as I say, cat is already out of the bag, so to speak. So I wouldn't recommend painfully keeping them apart, but encouraging one to cover one's cough, washing hands, getting them involved with the family is a more wholesome way to heal than being isolated and separated. So having said that, if someone is sick at home, do your best to keep them away from the young infants, especially the ones under 8 weeks old. And for older kids and older infants, still use caution and good hand hygiene practices to minimize the spread of illnesses amongst family members. Question 4, when can my child go back to school? Minor illnesses, colds, and even the more serious infections like influenza and RSV can have symptoms lasting anywhere from 5 days to several weeks. Most schools require 1 full day of your child being fever-free before returning to school. And I think it would be prudent to also take into consideration how well your child feels. If he's tired and struggling to get out of bed, having been sick for the last few days, or if he's hardly eating or energetic, then even without the fever, it may still be a good idea to let him stay home and rest and recover. And yes, you're hearing this recurring theme of taking time to rest and fully recover because it is so crucial. Kids with a cough that needs breathing treatments like albuterol or inhalers may also benefit from having more time at home before returning to school so that they can be monitored more closely by their caregivers. Question 5, what can I give my child for a cough? It depends on the age. For little babies under 1 year of age, avoid honey, and that is an absolute no because of the risk of botulism caused by bacteria that's often found in raw honey. There are some over-the-counter options for little babies for cough that mainly work by soothing the throat and the airways, and that's an excellent point of discussion with your pediatrician. For young kids over 1 year of age but below 6 years of age, there's other over-the-counter options like Zarbee's, Highland's Cough and Cold, Mommy Bliss, cough syrup that you can try at home. For kids older than 6 years of age, there are over-the-counter medications and also prescription strength medicine that your pediatrician may recommend. In general, it is important to remember that children can cough up to 3 to 4 weeks, even from a common cold. I often see parents that worry when their child is still coughing 1 to 2 weeks out, even though the child is behaving well. I just want to mention here that not all coughs are harmful. Coughing doesn't have to be blocked or controlled because we cough as a way to clear out that secretions in the airway or clearing out the phlegm. However, when that cough becomes problematic, as in disrupting sleep, worsening in intensity, or it's accompanied by shortness of breath, that would all probably warrant a visit to your pediatrician's office for further evaluation and possibly treatment. In our Las Vegas-based practice, we work with families one-on-one, offering concierge individualized care to each patient, holistically minimizing the unnecessary pharmaceuticals and treating the root cause. To learn more about how you can work with us, click on Become a Member and fill out the information so that we can schedule a time to chat. Thank you all for watching, and see you next time as we navigate the world of holistic pediatric medicine.